Hello, I am Dr. Nagaraj B Puttaswamy. Many patients are under the perceptions, or maybe if you my doctor friends are also, particularly physicians, if the gallbladder is silent, why do we remove that? See, we have seen patients with hundreds of gallbladder stones dying with age-related activities and not related to gallbladder stones. Definitely, yes, there is a possibility that patient can still go on and complete their lifetime without any complications related to gallstones. But the percentage is less. People who are getting into complications, the percentage is very, very high. So, we don't want our known patients to get into a problem. See, if I have not even undergone ultrasound abdomen and I don't know about a gallbladder problem, then but I land up in a complicated scenario, definitely yes, we have to attend to them. See, what are the big complications? I already tried to tell. Acute cholecystitis, empyema gallbladder, mucocele of gallbladder, abscess of gallbladder, perforations of gallbladder we have seen, gangrenous gallbladders we have seen. All these are complex gallbladder conditions which we try and see. All these would require laparoscopic surgeries. And does a role be there to do laparoscopic surgery for gallbladder cancer? Yes, if it is within the limits. And many a times after removing the gallbladder, we try and send the patient specimen for histopathology. That reveals that there is a early cancer of gallbladders. So what is the end of that? See, laparoscopic cholecystectomy would have been sufficient because we have not found any lymph node deposits. We don't have seen any deposits on the liver surface. That is the beauty of it. So all these conditions will have to be undergoing laparoscopic removal of gallbladder. What is an alternative mode of treatment for gallstones instead of getting operated? See, generally we have gallstone digestive products, allopathically, homeopathically, ayurvedically. See, a lot of patients try to adopt and try and get themselves under the supervision of the respective specialist. Our physician or gastro specialist would definitely advise them stone digestive drugs. But unfortunately, this is not a one-time solution, or it is not a 5-day, 10-day course. We have to be on these drugs for months together, and then we have to be under the radar of the doctor, or maybe recurrent ultrasound need to be done. But in case in between the patient develops acute cholecystitis or complex related scenarios, we have to jump in and operate. Or is it assured that any mode of any pathies which I try to mention, allopathy, ayurveda or homeopathy, which will try and help us to get rid of stones as assured or 100%? I don't think it is a possibility. It is not that very easy. It's not like a urinary stone. A small urinary stone, if you try and give a good muscle relaxant and then you allow the urine to pass more, maybe ask the patient to drink more water and give a diuretic, probably the small stone of 3 or 4 mm could invariably get passed out in the urine. But you cannot enhance the secretion of bile in that way. All the drugs which I am trying to tell, any form of medicine, is they can only lessen the viscosity of bile production. Only by that mode, the stone may slowly become smaller. We have read about how rocks are formed and how rocks are tethered. So similarly, these stones can slowly get tethered and then they can come out. Formation of stone is also important. Say a cholesterol-rich stone can probably tether more easily when compared to a bile pigment stone. So, or many a times it will be a mixed stone. It's not that very easy to treat gallstone medically and making a strong and a dogmatic assured statement saying that I'll completely cure gallstones without surgery. It is not a fair statement, and maybe I will be trying to fool around with the patient to try and make a statement. But very unfortunately, I have seen patients with having 5, 10, 20 ultrasounds repeated over a period of 1, 2, 3 years. Keep telling, say, okay, my stones were about 1 centimeter, 1.5 centimeter. Now they have come to 0.9, 0.8, 10. It all again be subjective on the ultrasound specialist who is performing the dimension measurement. What I personally suggest is, if there is sludge is small thick gall material of bile which is there in the gallbladder. Sometimes infection can also trigger something like this. So this is where we come into role in treating medically. Sludge can be definitely digested or made it thin, and it can be allowed to pass in the form of the liquid bile. But definitely formed stones are very, very hard to break by medicines.